not gonna be, and then you folks that are here, they also offer a human bio, but that's that's actually more like non-science majors and whatnot, but like I said, if you've taken A&P 1 and 2, if you've taken the human anatomy, or whatnot, you know, you're in good shape, you're fine, because you'd be surprised, you may know anatomy, you may have taken that, but as quickly as it came into your hippocampus, as quickly it went away. Okay, so this is a nice little refresher to get you on board so that you know what I'm talking about, because folks, a lot of this course is going to encompass what? Anatomy of the what? Of the nervous system, okay? Of the nervous system, okay? All this terminology, all this vocab, you know, I'm gonna give you an intro here, some information here, but once we get into the vocabulary, into the language of anatomy, right? Like this, planes and sections, directional, body cavities, you need to know what's going on, okay? Histology, I'll give you some basic histo, et cetera, et cetera. All this information that's pertinent to this course, okay? All right, so let's get started here, guys. So your first slide is, now as far as, you know, some overview of anatomy here, right? We're gonna take a look at some information here with regards to, okay, for example, what does anatomy mean is to break things apart, right? You wanna, you know, break things down into bits and pieces to have a better understanding of the big picture, right? So when you're addressing gross anatomy, well, people think of gross anatomy, they say, it's like, oh, it's nasty, disgusting. No, the gross anatomy means it is what? Macroscopic, okay? It does not require any kind of visual aid, right? And when you're addressing facets of gross anatomy, you have, or I should say examples of gross anatomy, you have surface anatomy. Now, when you're addressing surface anatomy, right, we're talking about what you see at the surface, what's salient, what jumps out at you, right? And if you come in contact with a patient, if you're administering therapy of sort or whatnot, then you have to come in contact with the patient by what's known as what? Ever heard of this term here? Palpation, right? Not palpitations, palpation. You palpate the patient, you palpate them, right? For example, if you have to go in and give it and administer to a patient an IM. What's an IM? Intramuscular, right? Or if you have to draw blood. If you have to draw blood from the patient, or intramuscular as an example. So if you walk into a room, you have to administer an IM to a patient, do you stand there about a couple feet away from the patient and throw the hypodermic needle at him like a dart? Do you?
No.
I hope not. You have problems if you do that. So no, you have to come in contact with the patient, you palpate them, you find the target, and hopefully you know your anatomy, right? You know your anatomy, your surface anatomy, and then you administer the IM, and you're good to go. So you have surface anatomy, regional anatomy. This is anatomy, approach to anatomy from a regions approach. So for examples of regional anatomy, you have head and neck, right? You have what? Thorax. What else? Another region. Abdomen. What else? In your back, right? So these are just all examples of a regional approach to learning anatomy. So when it comes to like the thorax, you learn the bones, the muscles, the nerves, the blood supply, the drainage of the thorax. Okay, so that's a regional approach to anatomy. Then what you folks that took anatomy either 3731 or at the colleges, you most likely learn anatomy from a what approach? Systems approach. Am I correct? Yeah. So you have so examples. You have what? Cardiovascular system, right? What else did you probably learn about? Skeletal, exactly. Yeah, your skeletal system. What else? Muscular. Is that how you spell that? Muscular. Yeah. No. I'm sorry. Muscular. No. Muscular. Right. Muscular. What else? Digestive. But what's the one of the most important systems that you will learn about this course? The nervous system. Okay, that's the focus in this course. The nervous system. We are gonna obviously tie it into other systems like the MSK, right? Because this coincides with the whole basis of what? Neurological dysfunction on what? Human performance. Okay, tying in the nervous system with the what? Muscular system or function. Okay. Then you have specialties in anatomy. You have, for example, clinical and surgical anatomy. Now, the thing with this, folks, is that, this is, whenever you have to learn or embark on learning clinical anatomy, you have to pretty much either be a surgeon or a clinician, but you also have to stay up to speed with this information based through journals, okay, through research in terms of, remember folks, we're not all the same. Sometimes there are body parts, there are things, there are anomalies or variants, or simply what variants, anomalies. Okay, hang on guys, let me, I have a tendency of writing hieroglyphics. Hang on. Let me try again. Let me try this again. Okay. So let's go like this. So let's go. Let me see here. Okay. Yeah. There you go. Anomalies, right? Or simply, that's another term. Variants, right? Things that are not the same. Things that you're not going to find in your typical anatomy textbook. Okay. Or it's not just simply. It's not everyday anatomy, right? So you have this, and then you also have radiographic anatomy. This is about what? It's about what? It's about what? It's about imaging. It's about capturing the anatomy through imaging, okay, through different types of instruments, okay? All right, so you have this breakdown of what is anatomy, guys, now, and then you have what's called microsurgical technique. Do you have this picture? Okay. Okay, this was a project that I obviously you can tell I never did it again, and I never embarked on, well, kind of, not really. So back in '04, I embarked on a project with a bunch of neurosurgeons over at the Lois Pope Center, and oh gosh, it was a major project. I had to cut into about, what was it, 60 heads, something like that, take out the brain, freeze it, inject it with latex, inject the blood vessels with latex. Actually, when I injected the vessels with latex, I was doing that and at the same time praying that there would be no what? No leaks, because once there was a leak in one of the vessels, it was no longer what? Useful. Then whip, try again. Okay, 60, okay. It took me about, I don't know, three hours to take a brain out? 3 hours, yeah, so do the math, how long it took me. This daunting task to do all this, and got paid how much? -5, nothing. Nothing. All that for just to for a journal. I'm like, okay, wow, whatever. Anyway, the idea of this, folks, is by doing this is to provide an instrument, a tool, instructional tool for surgeons, so when they go in and work on real people, they don't drop the ball. Okay, so that's the idea of doing this, is to guide them, so when they go in there and actually do an actual surgery, and tracing the vasculature or a surgery that involves the vasculature of the brain, they don't drop the ball. Okay, so what's this here? X-ray, or you can call it an X-ray, or we can call it what? A radiograph. Very good, a radiograph. Like, guys, what are the limitations to this? You only see what? Mostly the predominant tissue you see is bone. Okay, that's true. But what's the other drawback aside from only seeing predominantly bone? You can see, faint structures. You can see like maybe blood vessels, nerves, right? But aside from that, what's the other limitation to a radiograph? It is what? It's what? It's two-dimensional. Okay, it's two-dimensional. So you're kind of limited to only seeing specific tissues, and it's two-dimensional. Okay. So but it is a vital tool when it comes to diagnosis and whatnot, but it's also limited or has a setback because it's only two-dimensional, okay? Now, what's this here? Do you have the picture, guys? Okay, so you have, let me put here somewhere. This is probably what? A CT scan, and this is what? An MRI. Now guys, what's the beauty of this in contrast to this? Now we can start to see evidence of what? What kind of tissue? Softer tissue. Now we start to see, guys, now we can actually see and visualize soft tissue, softer tissue. Okay, soft tissue. Actually, if you look here, now we can see evidence that there is what inside the cranial cavity. What's this, guys? Brain. You can see brain, right? You can see brain tissue. Here, from this angle, you can see evidence of a what? Eyeball. You can see optic nerve, right? Things of that nature, okay? Over here, you can see also in the MRI, you see evidence of what, brain tissue, and you can see, what do you think this is? Muscle, that's muscle, exactly. So again, the basis here is that you're able to see and visualize now, as opposed to the radiograph, softer tissue. Also, the beauty of this type of imaging is that you can see the patient from various what? Various planes, right, or angles, but or planes, okay, pretty much planes, okay? You learn about this in a bit when I start going over some of the vocabulary with regards to planes, okay? You have this picture? Okay, now this is about capturing not only, it's very similar, as you can see, it's very similar, it's not the same, identical to an MRI, right? But however, now you're able to highlight and observe, see these little brightly colored areas? Okay, these are considered hot spots. Okay, so now you're able to observe and look at and check out brain activity. Okay, brain activity, you can pick up on that pretty much, okay? Brain activity, and so forth. So it is somewhat of a physiological type of imaging. You're able to catch brain activity, okay? And this is called, they call this PET. Positron emissions topography, something like that. Tomography, something like that, okay? It's PET, okay? Type of imaging. Now, okay, I'm done with that, right? Yeah, see, they call it PET, CT, okay? Now, the next slides, folks, is just simply going to give you a little insight into some of the systems, especially the ones that are just samples of some systems, guys, here. So, for example, you have nervous system, right? That's going to be the focus point for this course, obviously, the nervous system. You can break it down into what? Central and what? Peripheral, right? So peripheral, that involves what? Brain and spinal cord, okay? And then peripheral nervous system, that involves the what? The peripheral nerves, or we can call these also what? Spinal nerves. Okay, and also, some folks like to address the cranial nerves also. And you folks are definitely going to learn about the cranial nerves in this course, the latter part of the course, where you have to map on some of these cranial nerves and where they course through and whatnot, okay? All right, so that's the nervous system. And also, guys, this system also involves, you have a functional component, the ANS, what's that? Autonomic nervous system, that's the network that never does what? That never what? Sleeps. Okay, that's the network that never, ever sleeps. It keeps your vital functions running, up and running, what, guys? 24/7, okay? It's wired to your vital bodily functions, organs that keep you, alive 24/7, okay? All right, so that's the overview of the nervous system and its components. You have central and peripheral. What's this? Skeletal, right? If you break this down, you have your, what's called your axial part of the skeleton, and the other part is the what? Appendicular, very good, okay. So axial, let me see here, axial is, let me see here, let me do this, okay, you have appendicular, okay, appendicular, and then you have what are known as upper extremities and your what? Well, actually, let me add a little more here, guys. In the appendicular, you have what's called your pectoral girdle. Pectoral girdle, right? And pectoral girdle and your UE or upper extremities. And then you have what's called the pelvic girdle, very good. The pelvic girdle. And the what? LE, what does LE stand for? Lower extremities, okay? And folks, obviously, as you know, this system is tied into which other system? Musculoskeletal, yeah, muscular. Sometimes they actually address both systems as one, MSK, musculoskeletal, right? Musculoskeletal. So you tie in your muscular with your skeletal, okay? So, so you have your skeletal system, and then you have, what's this, guys? Cardiovascular, okay? And what does that involve? Study, okay, if you're focusing on the structure and function Study of the structure and function of the heart, what do you call that study? Cardiology, okay. If you're focusing on the structure and function of these things here, what do you call that study? Angiology, very good. Study of the blood vessels, okay. You have heart, you have veins, arteries, you have capillaries, okay. And guys, arteries do what? One word definition. Arteries do what? One word definition. Supply. Veins what? Drain. Okay. Arteries supply blood, veins drain. And then, so we have cardiology, study of the heart, structure and function of the heart. Angiology, study of structure and function of the what? Blood vessels. And what's missing here? One more study. Sorry? Hematology, what's that study of structure and function of the what? Of blood. Okay. You look familiar. Of course you take. Oh, okay, yeah, I know that course. Hematology, that study of what life? Blood, okay. All right, so you have this. Oh, you had your first medication last night, right? Okay. And you're smiling, so I guess it didn't go down that bad, right? Okay, see, look, I have a calculator right here. How was that first medication in the other course?
Oh, was it?
Yeah. Okay, there you go. Satisfied customer, right? Okay, moving on now. Okay, good. Look here. Then you have, what's this here?
Respiratory.
Respiratory, right, exactly. So now this can be broken down into, you have upper and what? And lower respiratory, okay? So upper, let me just simply outline. So upper would be pretty much, nasal cavity, your nose, your pharynx, right to about the level of your larynx, okay? And then that's considered upper respiratory, right? And then what's lower? From the trachea all the way down to your what? To your lungs, okay? And then that's considered lower respiratory. So you have upper respiratory, lower respiratory. And guys, and remember, keep in mind your breathing pattern, that whole breathing pattern that you have, that's wired to your what system? To your autonomic. Can you hold your breath? Can you voluntarily hold your breath? Yeah. For what? Forever? Of course not. A little bit, yeah. And then eventually, what overwhelms or what takes over? And then says, no. We have control of this. Okay, it keeps it going. Otherwise, anyhow. So you have this here. You have this. Oh yeah, this is also wired to your what? This system to your what? ANS. Yeah. Okay. I mean, when you go to bed tonight, can you shut off your light in your bedroom? Yes. Can you shut your TV off? Can you shut off your phone? Can you shut off your I don't know. Well, you can't say your parents' mouth, but anyway, you can't do that. Well, but get my point. Can you shut off everything? Yes, but can you say, okay, heart, stop beating? No. You can't do that. You can't afford to do that, okay? If you do, that's fine, but then you end up on my table. No problem. Okay. What's this here, guys? MSK, I already addressed it. Now, MSK, muscular, same as the skeletal. You have the muscles of the head and neck, muscles of the thorax, I see like the abdomen and the pelvic floor. You can see from here if it's inside, right? Oh, that occludes the pelvic outlet. So these are the components of the so-called axial, right, musculature. Right? Then everything else, for example, like your shoulder blade, I should say your scapula, or your pectoral girdle and your upper extremities, right? That's your appendicular musculature. So you have your axial and your appendicular, okay? Axial and appendicular musculature. Okay? Upper and, what do we call it? And then you have lower would involve your pelvic girdle and your what? Lower extremities, okay? And that's all tied. Now remember guys, this is all tied into your skeletal system, okay? All right, so you have your nervous system, cardiovascular, respiratory, so forth. What's this? Digestive, yeah, digestive. Again, you have your main digestive system. So whatever you take in goes into this main part, the so-called alimentary canal. It goes to the to the stomach, into this whole intestine and so forth. And then you have your accessories, which are your what? Salivary glands, your what? Your teeth, your liver, right? Your pancreas and so forth, your gallbladder, okay? All right, so you have your upper respiratory, muscular system, digestive, what's this? The what? Endocrine, yeah. So it's all about the what, guys? Hormones, exactly. Endocrine system, okay? A good amount of small organs, right, and they're all scattered throughout the body. You have your master gland, which is here. What's that? Your pituitary, right? Now that little pea-sized organ, that gland, is under influence. It doesn't do its own thing, folks. It actually disseminates. You know, it pretty much sends hormones, you know, to other targets, body parts, and so forth. But it is under influence. It is under control of this part right here, the hypothalamus. That's what governs the what? The pituitary. And the hypothalamus is part of your what, guys? Part of your what? Of your CNS, of your brain. Okay? It's inside the brain. So you have your pituitary gland, you have what's this one right here, your thyroid, right? You have your what? Tiny little parathyroids that are within the thyroid, right? You have your, I don't want to, thymus, that's more for the immune system. You have your adrenal glands, okay? These sit on top of your kidneys. So I've just mapped out for you folks the main standalone glands, okay? Your pituitary, your thyroid, your parathyroids, and your adrenal glands, okay? Everything else, there are other body parts like your pancreas, your kidney, your testes, your ovaries, that they are organs that serve other purposes, but they also can produce or secrete what? Hormones, okay? They can secrete hormones. Okay, so guys, so I'm done with the little survey of some of the systems, intro to the anatomy and so forth. And now let's go into planes and sections. So when you're addressing a sagittal plane, what are you dividing the body into? Sagittal plane. It's going to divide the body into what? Right and left what? Halves. Right and left halves. Okay, right and left. Okay, right and left. You're going to the sagittal plane. Now, if it's mid-sagittal, it's supposed to be what? Equal right and left halves. Okay? Equal right and left halves. Now, parasagittal, this is obviously of what? Of what? Off center, okay. So by being off center, still in that sagittal plane, it is going to be what? Unequal right and left halves, okay? So if it's mid-sagittal, dead back in the center, it's going to give you equal right and left halves. If it's parasagittal, it's off center, okay? Frontal coronal plane, what does that separate? What from what? Anterior from what? Exactly, from posterior. Exactly, front and back, okay? Frontal / coronal plane, these planes are synonymous, okay? You'll hear about these planes when we start to look at what? Some of this imaging here. Here's an image right here. Here's a coronal plane right here, coronal view of a brain, okay? All right, so you have here coronal, transverse, horizontal, another term here, axial, okay? What does this separate? Superior from what? From inferior, exactly, okay? So separate upper from lower, or superior from inferior. Okay, so you have your planes and sections, I guess we call it that. Then, guys, now we can jump into some of the directional terminology. Again, you should have been exposed to this in the previous course, anatomy course. If not, if you took human bio, probably didn't give you this much of this vocab. You'll learn it here, okay? So, posterior is sometimes it's synonymous with dorsal. What does that allude to? What part? Back, okay. Anterior / ventral, what does that refer to? Front, okay, what's front, right? Superior cranial means towards what? Towards the head, right, going up. Inferior / caudal means towards the what? This is towards the head. Caudal meaning what? Towards your what? Towards the tail, right? Or going down. Lateral, away from where? from the midline, exactly, away from the midline, very good, okay, away from the midline, moving towards the, away from the midline in a lateral aspect, lateral direction. Now, medial is what? Opposite, so it's opposite, lateral, so it is towards the what, midline. I should just point to this, towards the midline, okay? Now, let me give you another term here, guys, don't get this confused, okay? Ever heard the term median? Okay, what does that mean? In the midline, dead smack in the center, okay, in the median. When you're in the median, you're in dead smack center, okay? So, median, don't get these terms confused. Medial means what? Moving towards the what? Towards the midline, towards the median, okay? Medial, moving towards the midline. Proximal means what? Proximal is located where? At the closest to the point of what? Of attachment, right? Closest to the point of what? Of attachment, obviously. Okay. And distal is what? Furthest. Furthest from what? Point of attachment, okay? So you have proximal, what's proximal is closer to the point of attachment, and distal is opposite, furthest from the point of attachment, okay? Obviously, guys, superficial means what? You can see it, right? Superficial, at the surface, right? At the surface, and obviously, if it's deep, it underlies what you see at the surface, okay? A superficial wound, okay? You can see a superficial wound, okay? Except on the nail, obviously the infection is going to be what? Deep, okay? All right, so you have your planes and sections, you have your directional terminology, right? You have body cavities, okay? You have dorsal cavity, okay, which is going to be our focus here. So you have your, you have two main cavities, you have dorsal cavity and ventral cavity, right? But our focus is going to be on the dorsal cavity. Because in the cranial cavity, what do you find in there? Your brain, what else? Your meninges, what else? Blood vessels, okay, etc. And then you find what? Nerves in there, etc. Okay, in the cranial cavity, okay, in the cranial cavity. Vertebral cavity, right? What do you find in there? Your spinal cord. And again, spinal cord, what else? Meninges, what else? Blood vessels, right? And what else coming off that? You find coming off there? Nerves, right, etc. Okay. So, and then guys, if you look here, you check here, okay, see this picture right here? You have this picture? This picture? Okay, so you have your cranial cavity right here, and notice how it is continuous here with the what? With the vertebral canal. Okay, follow the red line. Right? And so what occupies the cranial cavity is your brain and so forth, etc. And then what occupies the vertebral canal is the what, guys? Spinal cord. Okay? And meninges and so forth, okay? All right, so you have our focus is going to be on the dorsal cavity. So let's go a little bit, guys, into some basic histology, because guys, you cannot separate histology from anatomy, right? Nor can you separate that from connective tissue also, okay? All right, guys, so for example, you have, now obviously this complements the study of gross anatomy, okay? Now tissues are groups of what? Cells with common and related functions, okay? And guys, here are the four basic tissue types. You have epithelial, right? Basic function of epithelium is to provide some kind of covering or lining. Next one is what? Connective tissue, okay? What does that provide? Support. It's a rather large umbrella. Connective tissue involves bone, ligaments, cartilage, so forth, okay? You'll see. Blood also, adipose, okay? Muscle, it's involved in what? Movement, okay? Whether it's body movement, visceral movement, okay? But it does involve movement. And finally, neural tissue, it's all about what? Control, okay? Neural, they also use this term also, nervous or neural, either term's correct, okay? Tip for that, okay? So moving on, guys. So do you have this picture? So this picture shows you folks comparing a simple epithelium from what? What's stratified, okay? Obviously, guys, if it's simple epithelium, you only have what? One cell layer, what? In thickness, okay? One cell layer in thickness. And also, guys, notice how each cell is in contact with the what? With the basement membrane, okay? In a simple epithelium. In a stratified epithelium, you have what? Multi-layers. Multi-layers of what? Of cells, okay? Is this cell at the top here connected to the basement membrane? No, it's not, okay? So it is stratified, multi-layered. And obviously, guys, also you have your, I don't think I went into this, was squamous, was cuboidal, not, I didn't bother with that. Just like the idea that you have a simple epithelium versus a stratified epithelium, okay? We will be coming across some cells when we address some of these cells that are like ependymal cells, cells that are in the support tissue of the nervous system. It is a specialized epithelial cell, so I'll address that, but at least you are familiar with what is considered epithelium, okay? Simple squamous is, in this instance, the cells are laterally flattened. Let me see, do I have that here? I'll just address you guys real quick. So, in a squamous cell, just to be safe, in a squamous cell, the width is going to exceed the what? The height, okay? In a cuboidal cell, the width is going to be what? The same to the height, right? And in a columnar cell, the height is going to what? Exceed the width. Okay, it's taller than it is wide. Okay, so by knowing this, then when we address the epithelium, like here, okay, or describing the simple squamous epithelium, the cells are what? Laterally flattened, right? Where do you find them? In areas of filtration and rapid diffusion. Here are examples of a simple squamous epithelium, okay? Ependymal cells, okay, that's a specialized set of epithelial cells. They provide a lining in some of these spaces, like your ventricles, lining of your ventricles inside your brain, ventricles in the brain, okay? Also, what lines the spinal, what's that called? Central canal, right, of the spinal cord. Okay, that's lined by ependymal cells. Yeah, well, so I have that here anyway. And these cells are also involved in the production of CSF. But guys, you'll learn about this when we get to the meninges part of the course. Neurothelium is what lines the arachnoid. Now, guys, the arachnoid is considered just an FYI. It's the middle layer of your what? Of your meninges, exactly, of your meninges. You probably heard of arachnoid matter in your previous courses or anatomy course, A&P, or whatever. Here it is here. So your middle layer being the arachnoid, okay? So that's lined by an epithelium known as a neurothelium, okay? It's lined by a simple epithelium known as a neurothelium. Okay, not much to add to that. Then you have your now guys, always remember, epithelium always overlies, always sits on top of what? Connective tissue, okay? Or CT is always deep to what? An epithelium, okay? So you find it everywhere in the body, it's never exposed, okay? If CT is exposed, there's most likely what? An injury, a lesion, okay? Here are the classes of CT. So you have CT proper, you learn about this, I think I covered that, right? Yeah, CT proper. You have cartilage, you have bone, and you have blood. So these are all examples or classes of what? Connective tissue, okay? CT proper, you can either be loose or you could be what?
Dense.
You could be dense, right? Okay. I'll show you that in a bit. Then here are the basic functions, guys, of CT. Provides binding and support, okay? Guys, think about it. You have ligaments, right? Ligaments attach what to what? Bone to bone, okay? CT provides protection, i.e., think about your what? Your skull, right? Your cranium. That protects your what? Your brain, soft tissue, okay? Insulation. What kind of tissue are we talking about? And please don't use the F word here. Adipose, very good. You say adipose, okay? That provides a little cushioning, okay? Think in terms of you think about, it's funny how you normally don't think about adipose tissue with the nervous system, but think in terms of your spinal cord. Okay, guys, think about it. Your spinal cord runs through this space called the what? Vertebral canal, but it's not just flopping around in there, guys. It's actually sitting, it's actually nestled nicely on a cushioning on a bed of what? Adipose tissue, okay? What does that do? It keeps it nicely what? Insulated. It gives, and it also provides it also provides a shock absorber, okay, or a means of minimizing impact, okay? All right, so you have your basic functions, right, of CT. So you have finding and support, right? You have protection, you have insulation, and also transportation. Think in terms of what? Blood, right? Blood is a vehicle, right? It transports stuff. Transports what? Nutrients. Transport what? Gases. Folks, does blood flow into your brain? Sure as heck better. Otherwise, if you don't have blood going to your brain, what's the end result to that? What do you call that? If you have blood and it goes to your brain, or they say blood to brain, and they say that becomes interrupted, what do you call that problem? A stroke. Right? And if you have a stroke, can that impede on human performance? Absolutely. Okay, absolutely. You need that blood to transport stuff. And what does blood transport to your brain? Gas, oxygen, okay? All right, so you have loose CT and you have what? Dense CT, okay? So, in loose CT, guys, here are examples of loose CT. You have areolar. This is the most widely distributed of the CTs. Here's basic functions, supports, binds on the tissues, reinforces, stores organs, stores nutrients, okay? Adipose, on the other hand, it predominates, you have a bunch of adipocytes that predominate this tissue. You have a displacement of the nucleus, right? Via this oil droplet. This tissue is vascularized. What does that mean, guys? It has a good amount of what? Blood flow, blood supply. So, basic function of the adipose tissue is to what? Insulate, okay? I said it earlier, insulate and acts as a shock absorber, i.e., in your what? Your spinal cord. Outside the spinal cord it is surrounded by what? Adipose tissue. Sits on the bed of that. And the idea is to provide not only insulation, but also act as a what? As a shock absorber, okay? So guys, here's a picture showing you what areolar tissue looks like, okay? Now guys, the basis for CT is that you have living versus non-living, okay? You have living components and non-living. Living component is going to be the what? The cells, right, in that tissue, and what's considered the non-living part. What we call the what? ECM. What does that stand for? Extracellular what? Matrix, exactly. The extracellular matrix, okay? So in CT you have the living part and everything everything outside the cells, guys, is going to be the extracellular matrix, okay? So you have loose CT, guys, here's areolar, here's adipose, okay? You can very easily identify adipose. You have all this lipid stuff here, right? And notice how it pushes off to the side the what? It displaces the what, guys? The nucleus, okay? Now, then you have dense CT, right? You have dense irregular, and dense irregular. Yeah, well, dense irregular CT is going to be my focus here, right? Now, why do they call it irregular? Because all these collagen fibers run in an irregular pattern, okay? That's why they call it dense irregular. Where do you find this tissue? You find it in the fibrous coverings of bones. So, you have what's known as your periosteum. Okay, periosteum. Okay, that's considered, dense irregular CT, periosteum. Perimysium. Okay, that's considered a CT that surrounds muscle. Perineurium. That's what surrounds what? Nervous system, nerves, and so forth, okay? So these are little examples of where you would find dense irregular connective tissue. Now, as far as, let me add to this, guys. As far as this here, dense, I have it here somewhere? I thought I did. Let me get back to this. As far as this is concerned, you have your dense, I'll just put it here in this slide, never mind. So here, okay, here's a picture here, guys, showing you dense what? Dense regular, okay, dense regular what? CT. Why do they call it dense regular? Because look at the fibers, they're all tightly knit. They're all running in what? Parallel rows, right? They're all tightly knit. Okay, parallel, arrangement, right? Where do you find dense regular CT? You find it at the core of what? What's this here, guys? Look at that is. What do you call that? That's a tendon. A tendon attaches what? Muscle to bone, okay? Here's another bone. And what attaches bone to bone? Ligaments, right? So here's a ligament here, okay? A ligament here. It's a ligament, okay. So in other words, folks, if you visit if you visit the doctor, right, and the doctor hits the patient where on this ligament, right, underneath the kneecap, they hit him there to induce a what? A knee what? A knee jerk. Exactly. Okay. So at the core of the ligament, that's composed of what? Dense, regular connective tissue. Okay. That's tied to the nervous system. You do that, that will elicit a arc, a reflex arc. Let's call that a knee jerk or a reflex arc. Okay, reflex arc. Okay, so you have your dense irregular, guys, and then I show you that. That's different from dense regular. Here's a picture showing you dense regular. Dense irregular connective tissue. Okay, dense irregular CT. Okay. Then, guys, you can see the collagen fibers running in what? Irregular pattern, pretty much, okay. Then you have bone, guys. You have your flat bones, you have irregular bones, okay. Examples of where you would find flat bones are the bones of your what? Your skull plates or your calvaria. The skulls here in your cranium, okay. Those are considered flat bones, right? Skull plates, so to speak, skull bones. Your irregular bones, odd shape, example of that would be your what? Your vertebrae. Guys, these bones surround and protect your what? Your spinal cord, okay? So those are examples of what? Of irregular bones. Compact bone is what's on the outside. At the core you have a spongy layer, so you have compact bone versus spongy bone. Diploid, that's a fancy term that describes spongy core, spongy core and compact bilayer. What does that mean, folks? Yeah, something like this. Let me just show you a picture of that. So here's a diploid right here. Spongy here at the core, and you have a compact what? Bilayer. Okay, think of it as like a sandwich. Compact outer, compact inner, right? Compact bone outside, compact bone in the inner part, and then you have in the center, you have what kind of bone? Texture? Spongy, okay? And an example of that would be what? In your skull. If you remove that piece, right here, folks, we've exposed what? Dense connective tissue here, part of your meninges, all right? And deep to that would be your what? Your brain. Foramina, these are little what? Little holes in bone, holes in the bones, okay? You will learn about these foramina, the little holes in the skull, because those are coursings, openings for what? Cranial nerves and what? Blood vessels, okay? In the skull. All right, so you have your dense CT, right? Then you have your bones. Then, guys, muscle tissue is a simple overview of this right here. You have blood vessels. Yeah, okay, so let me, I'll cover this right now. So you have your muscles, guys. So you have, in the body, you have skeletal muscle. What else do you have? cardiac muscle, and what, smooth muscle. Now guys, these fibers are the longest of the muscle types. What do you see in this type of muscle tissue, guys? You see striations, right? Contractions of skeletal muscle are what? Are voluntary. Most body movements are what? Voluntary. If it has skeletal muscle, most likely you have control of that. Okay. What would be somewhat of an exception to that rule in terms of voluntary, I should say, somewhat involuntary contractions of somatic muscles, of skeletal muscle? Somebody said it? Aside from that? No, not hard, no. Not there yet. What action do you do on a minute by minute, second by second basis that you're not really paying attention, but it is happening? Blinking, exactly, yeah, guys. Your oculi muscles, right? Your blinking oculi muscles. That's involved in what? In blinking. Okay, what else are you doing aside from blinking?
Breathing.
Huh? Somebody said it.
Breathing.
Breathing. So we're talking about which muscles? That are involved in breathing. Huh? Very good. Your intercostals. Very good. Your intercostals. And what else? Can your intercostals work with which muscle aside from the intercostals and your what? Diaphragm. Very good. Okay, your diaphragm. Okay, so those muscles work interchangeably to what? In the mechanics of breathing, exactly. Okay. So you do this involuntarily. What else? One more. What else are you doing aside from blinking or fighting the whole eyelids from going down like this? Aside from doing that and breathing, what else are you doing? Let's say you're not chewing gum, so don't say master as well. If you're not chewing gum, so you're blinking. Who said that? Swallowing, yeah. So you're using what? If you're swallowing, you're using pharyngeal constrictors, exactly. Your pharynx. You're using your pharyngeal, constrictors, exactly. Your pharyngeal constrictors. I.e., these are muscles involved in what? In swallowing. You're swallowing, okay? So guys, again, you do have control of these muscles, but for the most part, most of the time, you're not really paying attention, okay? All right, so your skeletal muscle, cardiac muscle is exclusive to what part? To where? What part of the heart? The walls, be specific. You can't say the heart walls. That's where you find cardiac muscle, in the heart walls, okay? It is similar to skeletal because it has what? What do you see? Striations. It's similar because you see evidence of striations, okay? We have a pacemaker that keeps that. Then your smooth muscle, where do you find that? In your visceral organs, right? In your gut tube, right? Stomach wall, gut tube, esophageal wall. You find it in the wall of what? Of your blood vessels, right? Okay. So forth. Now, the contractions of the smooth muscles is going to be what? Involuntary. Do you have control of that? No, you don't. Okay. So you have, muscles. This muscle involved in what? Ever heard of this? Peristalsis. Okay, the movement of food stuff through the gut, through the gut tube, right? What else? Ever heard of this? Vasal what? Constriction. What's that? Blood vessels doing this, right? Doing this. Okay. That's the walls of blood vessels have what? Smooth muscle. You don't have control of that. That's autonomic. Okay, so that's your overview of muscle tissue that you do find in the body, and it does have ties to the nervous system also. Okay. Obviously, guys, cardiac and smooth muscle is tied into which system? To what? To the ANS. Exactly. ANS. It's wired to the ANS. Okay. Okay. Then you have your cardiovascular system, guys. You have your blood vessels. Vessels carry. It's a closed system that begins and ends at the heart. Okay. And as I said earlier, what do arteries do? They what? Supply, veins what? Veins drain. Okay. So it starts at the heart. Arteries, arterioles, down to capillary bed. Okay. Obviously, well, in the capillary bed, what do you have going on here, guys? Some kind of exchange going on, right? Exchange going on, and then you have venules, veins, and what? Back to the heart. Generally speaking, folks, blood from the heart. Oh, I should even say that. Blood from the heart is mostly the blood in arteries is mostly what kind of blood, guys? Oxy blood, and blood in the veins, deoxy. What's the exception to that rule? Pulmonaries, okay? The pulmonary vessels, it's the opposite. But for the most part, most arteries carry what? Oxy blood, veins carry what? Deoxy blood, okay? For the most part. Then guys, how are blood vessels put together? How are they configured? They all have a tube within tube arrangement. Tunics, layers, okay? So you have 3 tunics surrounded by a lumen. What's a lumen? The kind of space, right? The space where blood courses through. Innermost lining of the blood vessel is the tunica intima. So we're going from innermost to outermost. Innermost is going to be your what? Tunica intima. Then you have a middle layer, right? That's your middle tunic. What's that composed of mostly? Smooth muscle, okay? That's where you have all that action going on. Constriction, vasoconstriction, dilation, and so forth. Elastin, that gives the blood vessel what? Recoil. Gives it elasticity. Guys, remember, blood's leaving from the left ventricle, entering the aorta under high what? Under high what? High pressure, okay? So it has to expand, and has a recoil also. And that middle tunic, guys, is regulated by the nerves of the what, guys? Look here, is wired to the what? ANS, because it's what? Smooth muscle, okay? As I said earlier, smooth muscle. Here are the actions of the smooth muscle, vasoconstriction and versus vasal what? Dilation, okay? And in arteries, the middle tunic is the what? Thickest layer. With regards to, if you compare veins to arteries, in arteries, the middle tunic is the thickest layer. Intima, middle tunic, and outermost tunic, okay? Adventitia. What does it have? Loose collagen fibers. It anchors the blood vessel in place, okay? And it's infiltrated with nerve fibers. There are nerve fibers in the outermost tunic, okay? That's why when they give you, when they try to draw blood out of you and they initially penetrate that blood vessel, you do feel the pain, right? Because of those nerve fibers. It's tied to the nervous system, okay? And that's why people have what? An aversion to what? They have an aversion, some people have an aversion to what? What do they call that? Phlebotomy. Okay, session, right? People take up draw blood, then they get all waked up because what happened? Because of the what? The nerve fibers picking up the pain, okay, of the needle going through the blood vessel wall. Hopefully they're a good phlebotomist. Otherwise, if they pierce through your entire blood vessel, then they are actually giving you a nice new tattoo 2 days later, right? All right? Okay. Here you have side-by-side comparison of what? Arteries versus what? Versus veins. Okay, arteries versus veins. Arteries, folks, are very easy to decipher. They have a thick middle what? A thick middle what? Middle tunic, as opposed to veins having a thin, sparse middle tunic, okay? How do veins differ from arteries? Veins have what in their innermost tunic? They have valves that prevent what? Backflow, okay? Guys, very easy to distinguish between arteries and veins. Veins always maintain their shape, round shape, because of the middle tunic. Arteries maintain their shape. They stay there, they keep their round shape because of the middle tunic being so thick. Veins, on the other hand, have a tendency of what? Collapsing, because of the sparse middle tunic, okay? You have arteries versus veins, okay? And then guys, you have the smallest of blood vessels. What are these? Capillaries, okay? Folks, if I'm not mistaken, I think that ends my intro to anatomy. Any questions? Any questions? Any questions? Okay, folks, so next week, I'm going to start with, I think, neurobio, intro to what a neuron is, how that works, basic function of that stuff. And then have you checked the schedule? I think there's something that says about peripheral nerve, something like that. Okay, there's a video on that. Okay, so make sure that, you know, I'll cover neurobio, and then after that, I'll just call it quits, and then you guys spend the rest of the time logging on and watching on the video on peripheral nerve. There's also a little mini video that talks about, I think, the cell respiration, something like that, okay? Any questions? Okay, folks, thanks for your, yes, yes. No, I didn't make you sweat a little bit, okay? Actually, hang on, listen, guys, did you hear that? She said, where's the study guide? And I said, I didn't make her sweat a little bit, right? However, what's your name? Jira, how do you create a study guide? Well, aside from watching videos, how do you create a study guide? What's the keyword? Omar, well, what's the keyword to this course?
Transcribe.
Thank you. Transcribe, it's called transcribe. By transcribing, what are you creating, Jiro? Your own study guide, Jiro's study guide, okay? Hey guys, you guys got this? That's what's key. Guys, and guys, listen up, this is important, okay? It's important. Transcribing is not watching a video or sitting in class and doing what? And doing this. This is what? Chicken scratch. Is this transcribing? No, that's just all over the place, right? Are you getting anything from that? No, okay? When you transcribe, what happens? It's magic. It all makes what? It makes sense, and you're connecting the what? The dots. And as you're transcribing, what are you doing? You're already what? Processing the information, you're already what? Digesting it, and you're reducing your what time? Study time, and you're increasing your what? Recreation time. And it makes you a what? A happy person, right? Right, people? Okay? Guys, that's the game plan. That's the game plan, okay? Remember, we're a team now. I'm the coach, you're the players. You guys have to be on your what? On your game. Don't be a what? A dolphin or a falcon. Or a, one more. Dolphin, falcon, or a
Marlin.
heat, or a marlin. Okay? We got that, folks? Okay, folks, students, have a nice weekend.